This is an I Am Listening exclusive podcast.
I myself didn't show any of these in the first knock I sustained in the game, and I thought I was fine. But what I think caused a lot of my problems, and there's evidence to show that this is often the case, is repeated head knocks before recovery from the first one. So it's super important that you recognize properly when to actually sit out, even if you feel okay or they're not necessarily showing some of these symptoms.
Welcome to Dr. Nicki Explains. I'm Dr. Nicki, a GP of 24 years experience, and this is my friend Sarah.
I'm a mum of 4 with no medical background.
We've decided to do a podcast to explain medical conditions, hopefully in an accessible way. We often have a guest speaker who has experience or expertise.
The podcast is not a substitute for seeing your GP. If you have medical symptoms that are troubling you, please see a doctor.
We've based the podcasts on NICE guidelines, which is the National Institute for Clinical Excellence.
The podcasts do contain graphic descriptions of medical conditions and may not be suitable for a younger audience or those of a sensitive nature.
Thank you for listening. Today we're going to discuss head injuries and concussion, and really looking at how you recognise when you need to get help and what you can do if you get long-term effects of concussion. And we've got a guest speaker with us today, and that's Dylan.
Hi guys, happy to be here.
Thank you so much for coming today, Dylan. Dylan has got some personal experience of this that we're going to hear about. And I'm Dr. Nicki.
And I'm Sarah. And welcome, Dylan. Thanks ever so much.
So, Dylan, I wondered if you could start off by telling us a little bit about your story when you were younger.
Well, when I was younger, I definitely liked my rugby a lot more than I liked my football, and not much has changed there. I was getting ready to go to football training on a Saturday. I think I was six or 7 years old, and I was sitting on a stool at home, being very difficult as young kids are. And my dad was putting my sock on. I don't know how it happened, but I just fell backwards off the stool and I cracked my head on the stone. My eyes turned into, static, almost like looking at a static TV screen. And I just remember saying, I can't see to my parents. They rushed me to hospital, and I just remember sitting in the A&E room vomiting, and my dad at the desk trying to get someone to help, just sitting there and waiting. I spent the night in hospital, and a few days later, I think I was fine, and I didn't think I had any other issues from it. I think I recovered fairly well.
Did you have an X-ray or anything in hospital, or you can't remember?
I can't remember, but not that I'm aware of.
No.
I think they just managed make sure things weren't getting worse, managed how I was responding, and then just kept a check on me.
So what was the next thing that happened?
So that was pretty much me until I had another knock when I was 12. I felt a bit sick, and that was really tough because I remember saying to the teachers at school, I've been concussed. And they just take a seat, have some water, relax.
And did you feel that you didn't really know what was going on?
Yeah. Because I remembered the feeling from before and saying, no, I think I'm concussed. And with some concussions, it takes a few hours before the symptoms kick in. Right. So you might feel a little bit off, but then a few hours later, you start to vomit and feel really sick, and it really starts to hit you. And that's why it's really important to kind of recognize and take it seriously. If you think you've had a head knock, you have to take it seriously, even if you think it might be okay. Again, I went to hospital there, but again, seemed to recover fine after a couple of days. And then after a long rugby career, many years playing for multiple teams.
Without banging your head at all?
Without ever thinking that I've got a concussion. Not to say I didn't bang my head. I banged my head a lot, but as all rugby players will know, and you get a little head knock, you feel dizzy for a second or two and you shake it off and play on. But at no point did I have that same feeling again where I was, wow, I've got concussed here.
Yeah.
Okay.
And so what age were you when you had, the big injury?
So I just turned 20. I was in my first year of university playing for a semi-professional team in Scotland. And you see, a lot of the guys were much bigger than me. I played as one of the forwards. My favorite thing was tackling and jumping in there and doing all the physical stuff. But I was a little bit smaller, so I had to be really careful and had to go low the whole time. So I was just in a game and I carried the ball and I got tackled. And because I carried low, his hip, I think, hit my head in the first half. One of those little dizzy moments, one of those second or two, am I okay? you don't want to take, you got to take these things seriously. So I was, do I feel okay? The feeling wore off quite quickly. And I thought, I'm okay to play on.
Fine.
At half time, I remember thinking maybe a little bit off, but nothing substantial. I didn't think I could have just been tired or, in the heat of the moment. But then in the second half, I carried the ball again, low again, and I hit my head on someone's knee. And this time I knew there was something wrong.
How did you know there was something wrong? What can you describe what people should look out for?
Well, it's a strange sensation where you've just kind of removed from reality for a moment or two, and that might go on for a while, and that doesn't necessarily mean a loss of consciousness. You feel like your whole perspective is shifted. You might forget why you're there. You might forget what's happening. You might lose focus. It can affect you in a whole load of different ways, but you will recognize that how you felt a second before the injury and a second afterwards are not the same.
No.
But I never lost consciousness. I got up. I tried to run back into the line and continue playing. We were right in the middle of the game. I put the ball back. I ran up. And then standing there, it just didn't wear off.
No.
Normally it wears off, and it didn't wear off this time. So I took a knee, and the physios came on. I spoke to the physios. But it was interesting because even after a minute or two, I pretty much felt okay. I thought, okay, I didn't lose consciousness. I can think straight. I know where I am. I know what the score is. I know all these sorts of things. But I definitely did hit my head. I came off because I was recommended to, under the guidelines now, if in doubt, sit them out. So if you think there's any kind of suspicion of a concussion, you just have to come off. But after a minute or two, the way I felt, if I had not had good physio care, or if I had really just said, no, look, I feel absolutely fine, I could easily have played on for the rest of the game and risked serious damage. Nevertheless, even coming off and passing my concussion test, just feeling a little bit wrong. In the coming days, I thought I'd be fine. I thought I would recover quickly like I had before, like most people did. And I didn't really take it seriously. I tried to do everything normal. I even went out with my friends and tried to have fun that night, as most guys will tell you that they do in sport. None of the kind of feeling of being wrong or, the symptoms of this lightheadedness, this fogginess I was experiencing, this heavy fatigue, just after a little bit of exercise, an inability to sleep, difficulty reading and looking at bright screens, all these symptoms, which I thought were fairly mild at the beginning, but just never disappeared. And the days went by and the weeks went by, and I was told just to wait and rest, and you will recover and it'll get better. And it should wear away eventually. For weeks and months, I saw specialists. I did MRI scans on my neck and my head, which showed there were no abnormalities or anything wrong, because an MRI scan doesn't show necessarily what, if you have a concussion, it can't diagnose it unless there's a structural damage there. And most of the time there isn't. And time went by and I just never recovered. I started getting migraines. Probably the scariest moment was my hand going numb when I was sitting at my desk, and the numbness traveled through my body, and then I couldn't feel my face or my legs. My mum rushed me to the hospital thinking I was having a stroke, and I wasn't sure at that point. I thought it was okay at the beginning, and then it just didn't wear off. It didn't wear off. But eventually I stayed in hospital for a bit, and they saw I wasn't having a stroke. It was just symptoms, migrainous symptoms from the concussion.
How terrifying for you.
And then probably once a month I would get a migraine like that, and then the numbness would be kind of constant in my body and in my hands and in my...
So, I think we have to distinguish here between the head injury and migraines, and they may well be linked, and it sounds like they were in your case because you didn't have any before it happened. But some people can get those hemiplegic migraines without any head injury. So I do see people coming in and it's like having a mini stroke where they can't feel half of their body and they have a migraine. So it sounds like some of what you're describing, it were migraines, but possibly brought on, and likely, by listening to your story, by the original head injury. It's worth just saying at this point that our podcast is no substitute for seeing a doctor, for going to A&E, for getting yourself scanned. This podcast is really just for information for people listening, and we'll try and give you as much information as possible, but there's no doubt that we might leave bits out that we don't mean to. And if you are in doubt,
sit them out.
Sit them out.
Can you explain what is concussion?
So concussion is a brain injury, effectively. Let's not kind of make it better than it is. It is an injury to the brain. Your brain is in a skull, which is a hard shell. And if you shake it hard enough, the brain underneath will swell. As Dylan has pointed out, you can see brain swelling if it's severe, but it may be that you can't see anything on a scan. But when you shake the brain up, you can either make it swell or bleed, and then it doesn't function properly. And interestingly, over 1 million people every year attend A&E in England and Wales with a head injury. And of those, only 5% have an abnormal conscious level. So what we use to discuss whether someone is fully conscious or not is something called the Glasgow Coma Scale. And if you go in with a severe head injury, you'll be marked as to how alert you are, whether you're responding to voices, this sort of thing. It's a scale. So most people that go to A&E have a normal GCS score when they arrive, and are discharged home, like Dylan was really, without admission to hospital. And in many cases, they don't get a scan. We have a kind of list of features that we use in order to diagnose whether people need a scan or not. So we'll go on to that. But I think one of the important things is that anyone can sustain a mild brain injury, and even seemingly trivial knocks can have lasting effects. The most at risk are very young children, young adult males, that's you, Dylan, and the elderly. And, this can be from a road traffic collision, a fall, an assault, an accident, sports injuries. And the problem is it's a sort of hidden disability, because it's very, very easy to miss a mild brain injury, as we've just heard really eloquently from Dylan. There might not be any external sign of injury. There might not be any loss of consciousness. Symptoms can overlap with other pre-existing symptoms. We've just heard about migraines. And the effect of the mild brain injury can only become apparent sometimes after other serious injuries have been treated. So if someone comes in a road crash, you're not going to focus on their concussion. You're going to fix their broken arm and leg first, aren't you? And the other big one is alcohol. If you're under the influence of alcohol and if you have a head injury, quite often that can mask how you are. And so if you see people as a doctor with a head injury and they're drunk or under the influence of alcohol, you really don't know the severity of their head injury until that has passed. And sometimes things are attributed. People trivialise the symptoms people have. And for example, you've had an assault. You're likely to be stressed. This is understandable because you've just been assaulted. You are going to feel a bit strange. But in actual fact, as we've said, the CT and MRI scans do not show damage at a microscopic level, and you can have widespread disturbance of the brain cells or neurons without them being visible on a scan.
Does concussion, is that bleeding or inflammation, or can it be both?
So it can be. So what's happening is the brain's being shaken in the skull, and that is going to cause microscopic damage. It can cause damage that does show up on a scan. If you're in a really major accident, you will have bleeding, and any bleeding causes the brain to swell. And of course, the problem is that it's in a hard container. There's no room for it to swell. So that swelling then causes pressure on the brain. However, as Dylan has said, you don't always see any changes at all. They are there, but you can't see them because it's a cellular level damage. And similarly we're going to get on to long-term effects, but with post-concussion syndrome, which we are going to discuss, they're really subtle defects in white cell matter. So in the brain, you have white cells, which form what we call the cerebrum, the kind of external bit of the brain. And when you do a scan, you can see subtle changes in white matter in people that have had post-concussion syndrome, but you have to have a really specialised MRI scan to have it. It's called a diffusion tensor MRI scan, and they're not commonly performed. So it's really hard to see that damage. You have to have a specialised scan. So you have to be thinking this could be post-concussion syndrome, and because it presents very vaguely, with these sort of symptoms that people aren't used to, then it is difficult to diagnose.
I think that probably brings us on to how to manage an acute injury. Having been involved with rugby and with horse riding, I know that there's the recognise, remove, recover, return mantra or guidelines. Should we talk a little bit about that? And I know rugby's been leading the way in this.
For sure, it's a super important and it's kind of super important issue, and rugby is now facing its sort of darkest days with the problems that concussion can cause. And as such, they're doing a lot of research into the best ways to manage it. The first step, as you say, is recognise. So if you think there's any suspicion, both as a bystander and as yourself, if you've got any suspicion of having sustained a head knock, the first step to do is to remove any risk of further head knocks. And that might show up as the collision itself, but you might not have seen the collision. So other things you could recognize are loss of consciousness, apparent confusion. So other things you might recognize are lying motionless, delay in getting up, facial injuries, blank or vacant expressions, disorientation, slow labored movements, or struggling with balance. These are some of the things that people might show once they've sustained a concussion, but at the same time, they might not show any of these. And you just have to go off the sense that you think that they've sustained a knock, or they think that they've sustained a knock. For example, I myself didn't show any of these in the first knock I sustained in the game, and I thought I was fine. But what I think caused a lot of my problems, and there's evidence to show that this is often the case, is repeated head knocks before recovery from the first one. So it's super important that you recognize properly when to actually sit out, even if you feel okay or they're not necessarily showing some of these symptoms.
As time goes on, I think we ought to mention some of the other kind of classic things that you can see with a head injury that maybe patients present to me with. And those are things like dizziness. It's things that we ask about. So dizziness, fatigue, which you mentioned actually, it can be very severe tiredness after minor activity. Epileptic seizures, obviously you would recognise there's a problem there, but that's really quite, in my experience as a GP, that's quite rare. They'd have to have quite a major injury for that. So headaches is a very, very common one, often severe and persistent. Nausea and vomiting, we've mentioned. Problems with sleeping, you mentioned, and that's a common one. Sensitivity to light and noise. We have sexual difficulties on the list as well, and visual disturbance, blurred vision and double vision.
In front of us, we've got a leaflet, which has been quite interesting to look at, produced by the British Equestrian Society. And on that, they've also talked about ringing in the ears, slurred speech, and changes to mood, personality or behaviour, and heightened emotions. Quite interesting.
And you might have trouble concentrating or have problems with your attention. You might have problems making decisions. You may have problems with your language and communication. Some people have problems recognising objects, facial recognition problems, even with family and friends. There are some kind of rarer things, such as perception problems, the inability to perceive colours, sounds, shapes, movement. You can get an acquired dyslexia. You can have problems processing information, problems with your memory, problem solving and planning and organisational difficulties. These are kind of all later effects, really. And then there's the sort of emotional side of things. You might find people get angry easily suddenly, that they get very apathetic and they don't want to do anything and they've lost the motivation they used to have, that they're irritable, anxious, depressed, and this is why there's a bit of a crossover. If you are a depressive, it can get missed. They might get mood swings, feel restless, have impulsivity and self-control problems. So people listening may recognise that in a loved one if they've had a recent head injury. And then that leads on to kind of problems with employment, and reduced independence. So those are all the things that we're recognising.
We've talked about removing off the pitch. Anything else?
You have to be aware that someone has just really banged their head and they might have a neck injury. So the first thing to be careful of if you are removing people off the pitch is their neck. So if there's any danger to that person, you need to leave them there until a trained professional arrives. Try and keep the person warm. And don't try removing, if they've got a helmet on for whatever reason, like in a riding accident, try and leave the helmet on unless you're really confident about and trained to remove it without moving their neck. And basically you need to call for help depending on how severe the head injury is. But if in doubt, call for an ambulance. If the patient is conscious, obviously, as Dylan says, really important to stop them continuing with the sport.
There's a useful list here of symptoms which would mean they should be triggers for definitely calling an ambulance, and that's neck pain, severe or worsening headache, double vision, weakness or tingling sensation in the limbs, vomiting, loss or deterioration of consciousness, seizures or convulsions, restless, combative or agitated behaviour.
Most people also, when they get concussions, a lot of the time they don't have these
any of them,
and they go home. So I suppose the question is, when should you think, oh wow, I should go to the hospital or see someone
well, definitely with any of those symptoms you should be going to hospital. And I always say to patients, if you are getting worse, so for example your child was not vomiting at the time of the injury but they are vomiting now, or they've developed double vision and they were fine before. The other big one for me, drowsiness, basically changes and any kind of concern. They're getting worse and they're not really picking up. And if in doubt, if you're not sure, then you won't do any harm by going to A&E. And they have a assessment tool for seeing whether you need a skull imaging to see whether you've got a skull fracture or a bleed or anything like that.
So the next part is recover. I'm guessing, Nicki, that the initial days after sustaining the concussion are pretty critical to recovery.
The real critical thing about the recovery period is that you mustn't do too much. So the advice really is that you should rest 48 to 72 hours at least afterwards, depending on how badly you had your head injury. Just go very gradually back to normal activity levels. And by activity levels, I don't mean go back to sport. I mean things like going for your dog walks. You will need to completely rest for 72 hours, avoiding screen time that was thought to be maybe a trigger for problems. So just try not to do too much physical activity and allow the healing to start.
Close supervision, Dylan, is that pretty important?
Definitely, especially in that first couple of days, that period. You've got to make sure that there are no other things happening. Nicki can tell us maybe a little bit about the potential hematomas and this sort of thing that might not be apparent on the day of the injury, but you have to monitor and make sure that there's not a more significant structural thing as well happening in those first few.
And I think that's exactly what you're trying to do. You're trying to allow some healing, because we will talk about this a bit more, but you really mustn't have any further head injury. And I always say that to patients, that in this period and look, while this is healing, any further head injury is going to be a problem. But Dylan's absolutely right that there is a form of head injury which is called a subdural hematoma, which is a bleed under the dura of the brain, which is one of the linings of the brain. And that can be something called a chronic or an acute one. So if you have a big bleed, it will show. But if you have a slow one, what you can find is that a few days down the line, that the person starts to fall over or feel dizzy or have a decreased level of consciousness, just be more confused. This is often the case with elderly patients, and the reason for that is that the layers surrounding the brain are much more fragile and more likely to bleed. Or in patients that are on anticoagulants or blood thinners. So those patients are much more at risk of bleeding and having these slow changes afterwards. So we have to keep an eye on that. And if that ever happens, then please report it. But Dylan, I think this is an area that you've had a lot of interest in and research about because of what happened to you, which we are going to discuss in a bit.
Certainly. So I've been doing a lot of research into actually how best to recover from concussion. And as you said, it's a difficult injury to diagnose, to quantify, to understand, because it feels like it's in your head. People say we don't understand the brain very well. So it's a difficult question, concussion recovery. But more and more what we're finding is it's this idea of relative rest in those first few days. So we don't want to do nothing. We don't want to completely stop our old lives. We don't want to completely reject any of the activities that we used to do. Because if we do that, then A, it'll put us into a mental space where we don't necessarily think we're recovering. But B, our brain won't learn to reconnect its old pathways and learn to really get back as strong as it was if we no longer test it. And that's not to say that we want to push into and do lots of exercise and do all these kinds of things.
Because you have to avoid banging your head again.
Exactly. And you'll definitely feel terrible if you tried. But there are now protocols coming out, such as the Buffalo concussion test, where we measure our heart rates and we work at a level with that below our symptom threshold, which is, if you can practice that with a certified medical practitioner, it's been shown and proven to be one of the best things for acute concussion recovery.
You mentioned, Dylan, actually, that there were some concussion specialists in the UK, not very many of them, but that they do exist.
Yeah, certainly. I mean, a lot of this research is coming from North America, of course, where all the money is and the big football and all this kind of stuff. Yeah. But it's coming over to the UK slowly. The number one thing you can do, the number one thing that will make sure you recover more than anything else, is to see a concussion specialist as early as possible. As you say, in the UK, this is a difficult question. There aren't many, but there are a few, and they're slowly starting to come up. So if you have a quick look online, if you look into it, look up any clinics that are trained in concussion treatment and concussion recovery management. The best thing you can do to make sure you make a full recovery is to go see one of them. And what they'll do is essentially look at all the different areas the concussion can affect you and start to rehab and retrain your body and brain within a moderate symptom threshold to make sure that you actually retrain and get back strong.
Okay, and that is not going to be obviously achievable for the vast majority of people listening to this podcast, unfortunately, because I think you said there were maybe 5 in the UK, and it sounds like it might be a private option that people probably can't get. But I think just knowing about the concussion protocol is really useful because it's something people can look at. And, you know, we have neurologists, which there's huge waits for on the NHS currently. But I think it may be worth what we will do, I think, Dylan, if it's okay with you, is to put some of this research as links at the end of the podcast that people can look up. So at least people can access it, even if they can't get hold of a concussion specialist because there's so few of them in the country. But I think that's really good advice. And if you have got the ability to see one, that sounds like a great option, especially if you've had a fairly major injury or you've got this post-concussion syndrome where your symptoms go on and on like yours did.
Definitely. Yeah. And even if you can't, the main thing to get from that is to not just put your whole life on hold because you've hit your head. It is an injury like any other injury, and doing nothing to fix it. It's like, and that's not to say
physio for heads, do you think?
It's like physio for heads. Yeah. And there are things and there are options. So if you're feeling lost and you think that I'm struggling, I'm worried about whether I'll ever recover from this, or you just think, what will I be okay next time? Just know there are options and there are ways that you can more definitely deal with this injury.
So in the case where your symptoms have subsided, let's say somebody's had a head injury, they have gone through this recovery time period and they want to return to sport, how long should they wait?
I mean, the current guidelines from Headway, which we are going to mention at the end as one of the most fantastic resources for people with head injuries, is that you leave it at least 21 days and at least 14 days after all your symptoms have subsided. And then really you should go back as a graduated return with stepwise progression in training, ensuring that your symptoms don't worsen as you increase your level of physical activity, which is what Dylan was saying, which, in other words, you keep your activity levels below the threshold that your symptoms return.
So we've talked about returning to sport, but obviously, people might have had concussion and need to return to work. Dylan, research on that?
Yeah, certainly. I mean, it can be a very difficult thing to do when you feel terrible all day and you think, well, I shouldn't work. I can't do any work. But actually, there's evidence that shows, again, if you do it in a managed and controlled and gradual way, for example, perhaps coming in and working half a day at first with some understanding from your colleagues, and then slowly building up your tolerance for work under your symptom threshold, that it actually improves your recovery. And not just that, it's your mental well-being, it's your feeling of being on top of your life and managing to get on with everything. So don't be too afraid to try and slowly get back into the workplace, as long as you're not feel like you're doing yourself any extra damage.
And is this again building up the pathways in the brain? So it's a physical recovery as well as a psychological recovery.
Exactly, and actually the two are very well linked. But we think that the interesting thing we think about the brain is it's quite an intangible organ. How do we don't understand it, we can barely even picture it and all this kind of thing. But the nice thing is, what the brain is just, it's the central system for the rest of your body. So that's what your body is doing, whether that be exercise or cognition or balancing or looking at things, is all going into your brain, healing and becoming strong again.
Can I just mention the DVLA as well and driving? If you have any condition that may affect your ability to drive, you have to, by law, inform the DVLA. And if you don't, you can get £1,000 fine and invalidate your insurance, possibly leading to a prosecution. So it is important that if you've had a concussion and you feel that your brain is affected, that you don't drive after a brain injury. Headway has a publication about this called Driving After Brain Injury that might help people understand when it's not appropriate to drive. And the other thing I wanted to mention, Dylan, was family. I see as a GP quite often families concerned about their loved one with concussion. And I think it's important to mention that families need a lot of support as well. And they need to understand this stuff, which is hopefully why this podcast will be helpful. Did your family find it really stressful? I'm sure they did.
No, definitely. Almost from my experience, it's harder on the families than it is on the patient, because a lot of the times whoever suffered the concussion doesn't even remember the incident, or they'll think that they're okay. And it's actually less of a traumatic incident for the child feeling the concussion than it is for the parents who have had to watch the terrible effects that it can have. So it's really important that families also go through these recognize, recover, return policies in a proper way, but also understand that if their loved ones are suffering and finding difficulty and they're not recovering properly, that it's normal. It happens to everyone with a brain injury. It will take time. And a nice thing to say as well is it's very difficult, as long as you're not taking any toxins like alcohol or drugs and this sort of thing. You won't really do extra damage. The damage is done.
Right.
So don't feel as if
you can never drink again.
Yeah, all that. but yeah, so they will be okay eventually. And if they're not getting better, there are places to look.
Good. The other thing is that might be a useful resource for parents is that there's something called the National Institute for Clinical Excellence, or NICE as it's called, and they have written discharge advice cards. So they have some for people 16 years and over, for carers of under 16-year-olds. And they just look really helpful. They give you a list of symptoms that should make you worry a bit more and seek medical advice. So as a resource, if people want somewhere to have a look at the NICE written discharge advice cards. So you just Google NICE and you'll see them there.
Let's talk a little bit about myths surrounding concussion.
There's definitely quite a few. One that you might have heard is don't let them sleep. This is the common one. Don't let them sleep after they've hit their head.
Yeah.
And actually, it's okay that they sleep. But the reason that we say that is to make sure we can monitor them for any worsening condition. So if they're asleep, it's very difficult to tell if they're getting worse or not. So the best thing to do is either wait 8 hours before you let them sleep, or if it's late in the night, let them sleep, but keep waking them up every now and then just to check on whether they've deteriorated. and need to go to hospital.
Because that's something we haven't said is someone with suspected concussion should not be left alone for the first 24 hours.
Absolutely not, no.
And also there's an alcohol. Don't consume alcohol in the first 24 hours and try and avoid alcohol until you're free of all concussion symptoms.
And we've talked about not driving a car, haven't we?
Yeah, we have.
And the alcohol question is actually much more important than you might think. I myself didn't heed this advice. And a week later, I drank far too much, as a 20-year-old student does.
Yeah.
I felt terrible afterwards. But I didn't think much of it. And I kept drinking throughout my condition until I just no longer could. However, it's super important because what happens after a concussion is they've shown that your gut actually becomes more permeable, and the brain cells, your neurons, also become more permeable. So your body becomes less able to filter out the toxins once you've sustained a concussion. There's also a period of inflammation in the brain after the initial injury, which means that if you start drinking and if you start even eating sugar, eating anything inflammatory, anything that might cause your body to provoke an inflammation response in your body, can actually have a very negative effect on your neuroinflammation and your recovery time. So it's really important, probably until you actually have returned to play fully, not to drink, not to take any other toxins, but even not to eat sugar,
That's
not to
really
eat
interesting.
processed food, all this kind of stuff. And it made a huge difference for me.
I think understanding the science behind it is so important. I think that will have helped so many people, Dylan, because just saying to someone, don't drink, I think it's so much more powerful to understand the science behind. Is it true that you can only get concussion if you hit your head?
Absolutely not. So here's an interesting stat for you. It actually takes 70 to 120 Gs of force to cause a concussion. It takes 4.5 Gs of force to cause whiplash, a neck injury.
Gosh.
So if that's the case, every single concussion or concussive hit is actually got an associated neck injury with it.
Yeah.
And the symptoms of whiplash are very similar, if not exactly the same, to the symptoms of concussion. Mm-hmm. And so you might not have hit your head at all, but you might experience and you might have a concussion because what causes it is really acceleration and deceleration of your head, which stretches the neurons in your brain. And so you really don't need to whack it hard. But on the flip side, it might give you a bit of comfort to know that if you bonk your head on the ceiling or something, you probably haven't given yourself a concussion. It does take a fairly substantial hit.
But you can fall on your bottom, can't you? And that can be enough impact to shake the brain. So I guess the message is you don't have to hit your head at all, do you, as you're saying?
Absolutely.
Anything that causes your body to suddenly stop can be enough to shake your head. So you don't have to hit it.
The common one is driving, road accidents.
Yes.
Another myth is that wearing a helmet or a hat, such as a riding hat or motorcycling helmet, will prevent concussion.
It's a complete myth because, like we've said, it's an acceleration and deceleration of the brain. It's a stop. And so a helmet doesn't change the G-forces going into your head, which is what actually causes the concussion.
Very interesting.
It's also not true that you only get concussion if you fall unconscious, as we know, because Dylan, you've just discussed that. That's another myth. And another myth is that there are tests to diagnose a concussion. And as we've mentioned, because it happens at a cellular level and it's microscopic, we don't have tests for that. So I think those are probably the common myths around it.
What are the long-term effects of a head injury, and how has this affected you, Dylan, in the long term?
So there's a few different ways it can affect you. So the most sort of obvious one is what we call, well, it actually used to be known as post-concussion syndrome, but now it's been relabeled persistent concussion symptoms.
Say that again. Persistent
concussion symptoms.
Right, okay.
Because syndrome is too vague and doesn't actually mean anything. And actually what's happening is your symptoms haven't disappeared. And this is potentially after you've had what we call a metabolic recovery. So the cells in your brain are back to normal, but you're still experiencing symptoms like that lightheadedness, light sensitivity, all the different things, migraines, whatever it might be that you've always experienced don't go away. I think the current diagnosis for that is 30 days after your concussion, you get diagnosed with PCS, as we abbreviate it to. And essentially what will happen there is you'll find that your symptoms just haven't disappeared. And so this is what happened to me. PCS is one thing. On the other side, you're getting stories like you might have heard of in NFL, and now it's coming out in rugby, where ex-sports players who have hit their head a lot, not necessarily experiencing concussions every time, but what we call subconcussive hits, then come out years later with early onset dementia and potential CTE diagnoses. Now, this isn't really a problem for the general public. This is more specialized in sport, and there's a lot of research to be done. But that is one thing, but we shouldn't really worry too much about that unless you are a professional sportsman or if you undergo the risk of hitting your head often. What is more likely to happen is PCS, persistent concussion symptoms. And
that's what you describe with what happened to you?
Exactly, yeah. So what happened with me was I found after a year on from my concussion, I had experienced almost no change in symptoms.
Gosh.
So I remember I would have good days and bad days. It's a very complex condition that can affect people in all sorts of different ways. So for some people, their mental health might be terrible because their hormones are affected. For some people, it might be exercise intolerance. For some people, they might be able to run a marathon, but they've got a really sore neck that won't go away, and they've just got this dizziness. And so it can affect everyone in different ways.
And how did this affect your life at this time? Because you must have been at university then. Absolutely.
I mean, this injury, in no exaggeration, completely changed my entire life. This is a serious condition. I could no longer play any sport. I could no longer read or study.
Dylan, just going back to I could no longer play any sport, that must have been devastating to you because rugby was your life, wasn't it? I mean, it was a huge part of your life.
For sure. And
you were intending to become professional possibly, but you were certainly playing at very high levels, weren't you?
Definitely. And I to be honest, 5 years on now, and I still probably haven't quite given up that one, just in terms of that feeling of not being able to play sport again and lose what's so important. And for me, that was probably the most difficult part. If you told me that, in 6 months it'll disappear and you could play sports again and everything will go back to normal, then I would have said, absolutely, I can wait 6 months and suffer. But the problem with PCS is, and this is so far what the perceived problem is, that there's nothing we can do. And so for me, I was in this stage where I couldn't play sport, but also the other things that I loved in my life, like socializing, going out with my friends, very difficult because you're tired the whole time. You can't drink anymore. You can't, but even not that, you can't go for walks. I would go for a 20-minute walk and just be exhausted.
You mentioned you couldn't read. How did you manage with your university studies?
Well, I had to stop. And that was also a tough part for me because funnily enough, I actually
give up your degree.
So for about a year, luckily for me, this coincided exactly with the beginning of COVID. So when I wasn't doing anything and was stuck at home, not being able to study, the universities had all shut down anyway. So I was very fortunate that I could take about a year off. And then when I got back to studying, I could do it in a very slow way because it was online classes. It was all in my own time. And luckily I do essay subjects and this sort of thing. So I could spend 6 months doing 200 words a day and get it done. But it was not easy, and it won't be easy for people.
So what you're saying is those 2 bangs to the head when you're playing rugby several years ago really changed your life. What advice would you give your younger self now? If you looked back, would you have done something differently?
Absolutely. But I would never have, my whole philosophy around it is, I don't think we should stop playing contact sports. I don't think we should stop putting ourselves at risk. There's this story I like to tell. When I was a little kid, I used to play a game with my brother called Knock Your Noggins. And this is as moronic as it sounds. So you sit there and you go 3, 2, 1, knock your noggins, and you headbutt each other. Wow. And that is probably the stupidest thing. And if, as mothers, I hope that you don't let your kids play that. Yeah. However, the point is, humans do that to themselves because it's fun. Humans sit there and play knock your noggins, or play rugby, or play football, or go horse riding, and put themselves in under these risks, because that's what life's about. It's about having fun. It's about putting yourself out there, and it's about pushing yourself out your comfort zone.
Although there are schools that are looking at versions of rugby where there's less contact and less risk. I realise that is going to be a different game, but I think, there may be that it is possible to have a sort of less likely to have head injury contact game.
Absolutely, but the problem with that is, and I don't agree with this current movement in preventing concussion, because no matter what, you're going to have head knocks in rugby or in horse riding or whatever it might be. Short of cancelling any risk, it's going to happen. And so what we really need to do, and what I would have changed with my journey, is not actually the sport itself. It's nothing. The sport is not to blame. It's how I actually managed and recovered from the injury, and making sure that I did all the right steps to get myself better, and then to a stage where I could go and play sport again. And what I did wrong there was, it's taken me now years, it's taken me 5 years nearly to actually learn all the best things to do to recover from that injury properly. The specialists to see how to target each of your different types of symptoms, and learn, actually, we can recover from these injuries. Well, the first step is to understand exactly how brain injury can affect you. And there are 5 main areas that we sort of like to talk about. The first is your autonomic nervous system. And to put that sort of in simple terms, what happens when you get a concussion is your fight or flight response gets a bit muddled up. So the parasympathetic nervous system and the sympathetic nervous system, which is really to say when you're at rest and when you're not at rest, gets confused. So your body doesn't respond to stimulus in the same way. So that might be exercise. And the common one that we see is heart rate there. So your heart rate is not increasing relative to the exercise that you're doing. So after a year, someone told me about this, and I went and measured my heart rate, and I noticed it was all over the place. I would walk a little bit and it would shoot up to 170, then drop back down and be all over the place. And this affects everyone to a degree who has a concussion. The way to fix this kind of area, is to promote you activate your nervous system. So that can be as simple as activating your your ganglia nerve, your vagal nerve. That's the one. Thanks, Nicki. And that can be something just like gargling water or humming. But a more kind of in-depth way to treat it is to start exercise again and do the buffalo protocol, it's called, which is measure your heart rate. You get on a treadmill with the physio or with the practitioner, and they find the heart rate level at which your symptoms increase by a significant degree. So that's maybe 3 points out of 10. You then reduce that a little bit and work at that level until you get used to your heart rate being at that level, and then you slowly increase it. So the theory is by the end, you've increased it all the way to its max capacity, and you've gotten rid of the symptoms associated with it. So I did this for about 6 months, and I would sit on the exercise bike and pedal, and the bike would just turn off because I was pedaling so slowly, because I had to keep my heart rate below 100 BPM. But after around 6 months, I noticed that it was actually increasing with my exercise and decreasing when I rested.
Brilliant.
And so this was a huge, I don't feel any different, but wow, there's a tangible achievement.
So you're almost reprogramming yourself.
Exactly. And that's kind of the way you can think about this. It's called neurovascular coupling. It's literally what the cells and the neurons in your brain, how they're connected to each other. And you can see it on a kind of physical scale. So that's the first thing. That's your nervous system. The second really common one, like we spoke about, is the neck. Like we said, there's probably an associated neck injury with every concussion, and it has very similar symptoms. So I definitely had a neck injury, and it was very difficult to diagnose because it wasn't necessarily that my neck was painful at any point. It wasn't necessarily. So I actually saw multiple physios for this, and they all basically said it was fine, and they did a bit of massaging and this sort of thing, and that can be effective. And sometimes massaging or having even acupuncture and dry needling and this sort of stuff, this can work to help release those muscles. But also it's a case of really getting rid of any tension in your neck and rebuilding your mobility and strength. So this can be very difficult to do, and you really have to do it with a practitioner, because if you take this wrong, I've triggered migraines before. If you get this wrong, you can trigger migraines, you can make yourself feel terrible. But the best thing is, if you shake your head a lot after a concussion, chances are you've got some sort of associated neck injury if that brings on symptoms, which is something you can recognize and then rehab. The third thing to talk about
is that rehab. Was that with a physio?
Exactly. A physio is normally the go-to. I would say chiropractors work as well, but be wary, because with a chiropractor, occasionally you have to be sure that any adjustments won't cause further damage in case you've got any kind of actual structural neck injury there. So you really have to be sure that you don't have that before you see a chiropractor, or at least be very clear with them that you're worried that you might have a structural neck injury. But a physio is normally your best bet.
I think if you have a structural neck injury, you really shouldn't go and see a chiropractor. I would not advise that at all.
I wasn't. Yeah.
So we've talked about the nervous system and we've talked about necks. What else?
The next one that's very common is your vestibular and visual system. So this is your eyes and this is your balance.
Right.
And they're connected. And so with this can be put out of whack when you hit your head, which kind of makes sense and was one of the commonest symptoms, like we were saying, light and noise sensitivity, dizziness, falling over, vertigo, very common. To rehab this kind of area, you really should need to go see a vision therapist. And there are certain, if you think you've got worse problems, you should get your eyes checked out anyway by a specialist.
By an optician.
By an optician. They'll be able to tell you if there are any core structural problems that the head knock might have caused. But if that's the case, but if you notice that you've had problems reading, problems looking at screens, the chances are you've got a vision problem. And the nice thing is we can rehab this. You have to go to a vision therapist, and what they'll do, they'll sit you down and they'll test all the different ways your eyes are working, the different ways that they work fine, and the different ways that they don't work fine. Vision therapists are normally available around the country, but most of them will be mostly experienced with children's vision problems.
Are we talking about orthoptists, or who are we talking? Who are these people?
I just
They're called vision therapists.
You can look up vision therapy and
I think just vision therapy.
Okay, that's really interesting.
Interesting.
I think just look up vision therapy and say, and just explain, ideally contact them and say, do you have any knowledge of concussion or any experience with concussion? And they might say yes or no. But even still, they'll be able to look at your eyes. And
a lot of what we're talking about, Dylan, just to clarify this, is PCS. It's persistent symptoms, because I just did want to mention the fact that 95% of people, they don't even go to hospital and they do recover fully. And so I don't want people to panic that they need to go and see a vision therapist with their child, because, to be honest, it's a very small, I know it's a serious problem and it's been an absolute nightmare for you and it's changed your life. And I think this is so positive for people that are suffering from persistent symptoms. But all this stuff we're discussing is really for that category of people.
Well, Nicki, it is, especially. However,
if you can get it for the acute.
If you can get it, but sadly, it's almost worse than you think. They've shown that around 30% of concussions do have lasting symptoms or lasting effects in your brain, even if you don't feel them. So it's not necessarily the case that when you recover symptomatically from your concussion, you've really actually, your brain has recovered fully. And some people go their entire lives, or for very, very long time, thinking that they've recovered from their concussion, but having a small little thing wrong. Maybe it's a hormone problem like we spoke about, or maybe it's, just a slight dizziness or vertigo every now and then that hasn't improved. And so this stuff is all relevant to acute concussion, but it's not always necessary.
Yeah.
So acute concussion will affect you in all these ways, but most of the time you will recover. And so the important thing to say with post-concussion or persistent concussion symptoms is that normally what happens is you don't recover normally because you've got multiple of these things going on at the same time. So what happened with me was I have this vision problem, but I know I had a neck injury as well, but also my nervous system wasn't right. And the kicker is you can't rehab your visual or your balance system if your neck is really tight and injured and sore. None of that, you can't rehab any of that if the blood flow in your body and your nervous system is out of whack. And so it's really a question of taking a holistic approach and going, and this poses no risk to acute concussive people either. So
no.
If you think that
it's just the availability and but that's if you can get it, that's fantastic.
Can you talk, are there any other areas of recovery?
It can really affect your hormones. Studies have shown that if you were with your mental health as well, if you were predisposed if you had any history of mental health problems as well and this sort of thing, you're far more likely to experience that after your concussion. And so your hormone regulation can be affected. But again, this is one that actually should be more easy to test for. If you can tell me, can you get that at the GP? Can they test your hormones?
We can test the effects of hormones at the GP. So, for example, low sodium level would be an easy one to check for. I was going to ask, sorry, just going back slightly, Dylan, you talked about rehabbing your eyes and your vision, but we didn't really hear how you did that.
Yeah, so it's actually quite, and this is also the other thing, you can't really hurt yourself by doing this. So if you suspect that you might have a problem, but you can't get to a vision therapist, what you can do is go online, look up the Brock string.
What's it?
So the Brock string, BROCK string.
String, as in
string.
Piece of string.
Yeah. And it is a piece of string with 3 beads on it at different intervals. And what you do is you tape it to the wall, you hold it to your nose, and you look and focus between each bead. And if you're having difficulty doing that, you know that you've got some sort of vision problem because your eyes aren't working together properly. So that's one of the exercises that we do, and there are plenty of them. The vestibular A chart is one. So this is just a chart with crosses on it and an A in the middle. If you look at this and move your head, so for me, I'd do that and the lines would all disappear and I could barely see anything on the chart because my visual stamina was so low. Whereas if you can do that and you think, okay, fine, I don't feel dizzy, I don't feel weird. After about a couple minutes, they start to disappear. Then you think, okay, that's fine. You don't have to worry about that. So there are things that you can do just at home that they might trigger symptoms,
really
maybe. But you can really look them up and print out these things. Another one is called saccades, SACCADES, I think. Horizontal and vertical, which is flicking your eyes between different letters. And so these are things that you might not have a problem with any of them, but you might only have a problem with one. And that if you just do them every day at a level, then the evidence has shown that you will slowly start to rehab your vision. However, it's important to note that I did this for years. So I've probably done a total of 2 or 3 years of vision exercises on a consistent basis and made little progress, but not full progress. And so it's not always so simple as, and this is why PCS is a difficult problem, because it's not always so simple as just you recognizing the issue. The rehab might be more difficult. And for me, I didn't realize it at the time, but because I had a neck injury and I wasn't going at it holistically, then just focusing on my eyes and my balance wasn't healing because the rest of my body wasn't in a state where that could then start to heal.
What about diet?
So diet is way more important than you might think. And it was a bit of a revelation to me because I've always been a bit skeptical about change your diet. It'll have all these effects and do all these different things. And there's so much misinformation out there and it's quite difficult. But really, the theory with the diet is because after a concussion, we know 2 things happen. We know that the gut becomes more permeable and we know that there's inflammation in the brain. There's a very well-researched connection between the gut and the brain, the gut-brain axis. And what happens is that inflammation in the brain after the concussion, if you eat poorly, if you have anything that causes inflammation, and that can be as simple as gluten or dairy, even if you're not lactose intolerant, it has the capacity to cause inflammation. That can have a big effect on neuroinflammation and stop you from recovering from any of this. And so after 3.5 years, I started to change my diet and I had never looked at it before. I'd stopped drinking, but I had never thought about not eating sugar or processed foods and this sort of thing. And after I did, I noticed my energy levels completely changed. I noticed that the other exercises I was doing, physical exercise became easier. My heart rate capacity went up, all these different effects.
You might say that would have happened to anyone who stopped eating processed foods.
For sure. And a lot of the problems that you get with concussion are actually just associated with chronic inflammation anyway.
I see, yeah.
So if you've got a history of poor diet, the chances are, and we're starting to think more and more that dementia is really just hugely a cause of chronic inflammation in the body. So you can never do wrong by bumping up the number of greens that you eat and getting rid of some of the toxins. So what I want to do and what I am doing is making a documentary to actually expose a lot of our understanding that we do have on brain injury and a lot of the simple ways that even at home we can manage and start to treat the problems. And then if we can do this, we can ensure that we can play contact sport. We can ensure that we don't have to fear this thing. I genuinely believe that if I knew when I hit my head what I know now, I would have been fine in 2 or 3 months.
That's extraordinary.
But following the steps that exist now, the common steps, the common understanding, and none of what I'm saying is really controversial. It's all been accepted in a lot of different studies and in big consensus groups, but it's getting the word out there. Mm-hmm. The common understanding is not helping people recover from their brain injuries.
And tell us how, when this documentary is going to be made, and how, when can we see it?
So we're in production now. We're hoping to be done with our first cut somewhere through next year. Where it'll be distributed, we still don't know. However, we hope that we can really shine a light on the ways that we can really deal with this problem and help people.
So any listeners who have production companies, they should contact you immediately.
And anyone with the story. Yeah. I mean, I just want to speak to more and more people who have experienced brain injury and get together, because that's almost one of the hardest parts is really sharing. It's very easy to feel alone with these things. Like you said, it doesn't affect most people. And even if you do get concussed and you feel better, that kind of helplessness with that uncertainty about, will I be okay in the future, especially with what's happening in the news now, can almost cause as many problems as the injury itself.
Dylan, I just wonder, there'll be people listening to this who are feeling, who are suffering from persistent concussion symptoms, or, thinking that they're never going to get better from their concussion. And are there any positives? What would you like to sort of say to those people?
Well, there's an interesting study that shows that no matter how many concussions that you've had, so they've taken people with up to 5 concussions in their life, with enough time between them, as long as you're sitting out and not getting knocks upon knocks, and they've had no cognitive deficiencies later in life. And actually, playing sport is better for your CTE and dementia diagnoses and your mental health diagnoses than even with a history of brain injury. So go out there, hit your head, but make sure that you recover properly and you manage it properly, and don't worry too much.
Brilliant. That's a really good message.
Yeah, absolutely brilliant. And, a huge thank you for giving up your time, both to come and see us and put in all this effort to make the documentary, which I think is going to be hugely helpful to many, many people.
Yes. I mean, as soon as we have the details of the documentary, we'd love to post it with this podcast so that people can watch that. Dylan, I think I've learned a lot doing this podcast, which has been really great. And I think, as you say, there's a lot of research out there. The way we look at concussion is changing as we learn more. And hopefully there will be more specialist, multidisciplinary type clinics available to people in the UK so that we can do the best to rehab people after this. Thank you so much. Thank you. We really appreciate it.
Thanks, guys. It's been a great fun.
Thanks ever so much.
We hope you've enjoyed this month's podcast. Don't forget that if this has made you aware of troubling medical symptoms, you may need to see your GP.
This has been an I Am Listening exclusive podcast. For more information, head over to our website, im-listening.co.uk.